Hello.
How you doing?
I'm doing well. How are you?
I'm doing well. I'm kind of tired and achy today, but
Oh no. In
yeah.
a explainable way given your past physical activity or in a you may be getting sick?
Um, I don't know. It's sort of hard to tell. I feel like it's not like a physical activity tired so much as like maybe the weather changing. Like there was
Mm-hmm.
that like storm. I'm like really sensitive to like pressure changes and stuff, and like I just felt like I didn't really get a good sleep. But yeah. I've had like a weird like swollen tonsil that's like not fully swollen, but just like just swollen enough for me to notice it for like the
Uh-huh.
last few days, but no other symptoms. So I don't know if my body has just been like like keeping an infection at bay this whole time, or if I'm just have allergies or what. I don't know.
Mm-hmm.
I think I also have a cavity on like one of my teeth, so I'm just
Oh
like
no.
I can't really do anything about it. Right now, but
Um, well, we
Hey,
as much
Charlie.
as
hi Kendall, how are you?
You know, I've got like a really sunny kind of window I'm by, and I've just like watched the rain come and go, so I'm actually doing pretty good. Like,
Yes,
in a good place.
it felt like such a like kind of cleansing storm. It just came and went so quickly.
Yeah, just really kind of like just washed a bit of it. It was nice. And you get like that, what is it called? Like the petrophore, like where the smell of rain on like new grass and it's
Mhm.
just like
Oh my
very like,
god,
mm.
I'm gonna open my window right now just because you said that. Like
So
I want to.
good. It's so good. It's so nice out. I got to go do my grocery shopping for the week. Putting it off.
oof. I just did that yesterday. They were giving like gloves out at the to come into the place and had like a social distancing line to get in. So it's actually like once I got into the store, one of the best shopping experiences I've had because usually they don't crowd control for you at the markets.
Right.
So I actually put my cart down. And
Wow. That's nice.
as people, Leslie and Corey, do you just want to introduce yourselves as you come in?
Okay, I'm Leslie. Hi. That good enough, or you want more?
I know a little bit about you. Do you just want to give like a sentence or two about who you are?
Okay. I'm a retired obstetrician, and now I'm a patient safety activist and health equity activist. And I am African American. My mother was white, and I look more like her than my dark-skinned father. But that makes for an interesting experience growing up in an all-Black neighborhood in the 50s and 60s. As you can imagine what my parents went through. So I got my phone out. I'm hoping to learn how to use Twitter because I just, we have a curriculum called ACT for Safe Motherhood, and we have a group of organization we're starting called Black Coalition for Safe Motherhood. It's about educating in group learning or couples learning to speak up for yourself, to ask questions, and claim your space, trust your body, tell your story. So we want to spread that nationwide. And in order to do that, I got to learn to use Twitter because there's not too many people with time on my team besides me. I'm retired, so that's the story. But I'm having a hard time with this.
Well, Leslie, thank you. So were you able to set up a handle for today?
I seem to be at Leslie 15, Leslie Faring 15.
Okay.
They cut my name. Yeah.
Are you talking to me on a laptop?
Yes, I have a laptop to talk to you, and I have the phones in my hand.
So a part of the action today is I'm going to be copying pasting links into the chat box. So if you can figure out how to get Twitter open on your computer and sign into your profile there, it may be easier to work from Twitter off of your computer than off of your phone. But this is it's a process, it's a journey, so we'll see what we learn today, and then
so I have to make this go into a small screen and then find Twitter on my laptop.
Yes, that give it a try, and if you get confused, just come back here and slowly we'll learn how to do it together. So I'm gonna share this. I see a couple other people coming in. I'm going to go ahead and get started with the PowerPoint for today. I cannot keep up with the chat box, so if you have any questions or comments, concerns, please just unmute yourself and interrupt me. The whole premise of this Zoom is a place for people to learn how to do Twitter. So if I'm talking too quickly, or if I said something that doesn't make sense, or you need me to show you how to do something again, please, that's why we're here. If you are already an experienced Twitter user, feel free to just do your own thing, keep me on in the background, and tune in when there's a more action-y thing. I'm learning as we're going. This PowerPoint is continuing to evolve, so let's see how it goes, and hopefully we'll have a good time today. I will say, so let me just share. All right, so you all can see my screen now. Great. And hold on one second. Where is the chat box? So, for those of you who already have Twitter, if you want to just tell your following that you are here in this Zoom and they can join us if they'd like, I just sent you the hyperlink to the tweet that is on the slide, so you can click through and write something to the effect of, "I'm with Brooklyn Grows." And if you @ me, if we aren't already following each other, if you @ me in that initial tweet, I can see you and start following you right from the beginning. Let's see.
Wait, sorry, Katie. So
yeah.
the hyperlink leads us where to?
So if you click on the hyperlink, it should open Twitter up right to that tweet that I have a screenshot of in the screen.
I don't think we can click it, but if you just copy and paste it into the URL, it should work just fine.
Yeah.
Thank you. Let me see. Who's here? Is there anyone I don't know or who doesn't know me? Okay, so all of you know generally who I am and the work that I've been up to. So I will go through this next part real quickly so we can get to the Twitter things. But I was working as a NICU nurse at a segregated Black hospital in Brooklyn. And I had been working there for a couple of years when I had first heard about racial health disparities in infant and maternal health care. I thought, oh, that's super problematic that I've been working at a predominantly Black serving hospital and didn't know that my patients were more likely to die before their first birthday working as a NICU nurse. I wonder if something we're doing as a hospital is contributing to that phenomenon. And I was right, we were. It turns out in New York City, somewhere between 40 and 50% of racial health disparities in infant maternal health outcome has to do with the worst quality of care at a concentrated set of minority serving hospitals. So if you want to learn more about kind of my background and the things I've been talking about and using Twitter to do activism on, I am copying and pasting to you guys the links that if you click through are going to open up Twitter to threads that I have done on various issues. So I think most of you I know or have been following me for a while, but if you haven't seen those threads, go ahead and take, some time in the future, take the time to read through them. I'm teaching some of the skills I'm teaching you today work better depending, like different things I'm going to teach you, you'll use more of or less of depending on what your goals are for Twitter. So Leslie, like if you are just trying to get in touch with your congressperson or your state senator is different than I imagine how you would want like the professional act handle to behave on Twitter. So what I'm explaining today is kind of how to use Twitter as individual citizens, but doing it as a citizen, you're going to be able to see how organizations do it, and it'll be much easier to like learn how to do it from an act handle. Does that make sense? So all right. So if you go through this thread, I outline a timeline of Medicaid cuts that Cuomo pushed through in 2017 with preventable deaths that took place in my hospital, because like despite the administration knowing we needed to hire more staff to care for our patients appropriately, we couldn't because Cuomo was cutting our budget. And despite us being in a pandemic, Cuomo has continued to cut our budget and is now saying that without federal aid, funding to schools and hospitals may be cut by as much as half. So to learn more about this, Senator Rivera did an interview that I linked to here that explains about these cuts, but it's like, but essentially why it's so pressing for us to be on Twitter and making our voices heard is that even though these policies have clearly led to harm in the past, we're still going through with them in the context of a pandemic, and we live in electoral democracy, so the way we speak out against that is through public protest, and in a time of social distancing, the way we can do that is on Twitter. So I started the campaign Equity for Downstate last year. When I resigned from my position, I knew that I wanted to work long-term to develop a process of truth, reconciliation, and reparations. But it takes a long time to write legislation that would do that. So our short-term goal was to focus on, to bring attention on racial disparities in health financing in New York State and drawing the connection to disparities in health outcomes. So Twitter Tuesday is essentially like a function of the Equity for Downstate campaign. And the reason why we're going to be focusing on the New York Health Act today is because the New York Health Act, which is New York's universal guaranteed healthcare bill, because it puts everybody on the same health insurance, it essentially eliminates the main driver of health financing disparities, which is private-public insurance. We eliminate the funding disparity, past New York Health is in line with Equity for Downstate's goal of eliminating funding disparities. And then there's like a million other reasons why it's a good idea to pass the New York Health Act in the context of the pandemic. Most people get their health insurance through their employers. A lot of people are losing their jobs. How are we going to cover everybody? Pass the New York Health Act. So for that reason, there's lots of other things that we need to be done long term, but this is a bill that we have ready to go. So despite kind of the bleak picture with Cuomo pushing through budget cuts, we do have some reasons to be optimistic in New York. Because as a state, we're richer than the nation. We have a higher GDP per capita than the federal government. And so all of the money we would need to run super robust social safety network programs, we already have in the state. We don't need to raise federal taxes. We just have to do things through state government level. And at the state government, we have a Democratic majority in both the Senate and in the Assembly. The New York State Assembly is essentially, think of it like Congress. you know, the Senate is the same as the federal level, and the Assembly is like the state Congress. So we have all the money we could need to finance super robust social safety networks, and we theoretically have the politicians in power to pass super robust social safety networks. Now it's our job as activists to push it over the finish line. And specifically with the New York Health Act, we are one vote short of having the majority. So there are 64 state senators in the Senate, and I think we have 31 or 32 co-sponsors of the bill. So we only need one more person to sign on to know we would have the votes to pass it. And I think it's like 120-day enrollment period. So it's the kind of thing like we could pass this tomorrow, and in 3 months from now, every New Yorker would have health insurance. Is 120 days, 3 months? I forget, I'm bad at math. 4 months? You guys get the idea. So besides Leslie, are there any brand new, first time, just made a Twitter account tweeters here? Daisy, I think I'm asking you because everyone else I've seen on Twitter.
Hey, hi, just unmuted my audio. Yeah, I'm new. I'm totally new.
Awesome. That's fantastic. So so Leslie and Daisy, this is for you. So the first step is to write your first tweet. And so I'm going to show you, I'm copying and pasting the text to you. And then I will show you how to do it from my dummy account. Hold on one second. Log out, log in. Sorry.
How are we supposed to look at your screen and then look at our screen at the same time?
If you can minimize the screen that I'm in and like put it in on half of your laptop, and then get another screen and minimize to put on the other half with Twitter in it, if that works. So for your very first tweet, if you essentially, let me do that slower. So if you log into Twitter and you are looking at a page that's, Leslie and Daisy, do you see a page similar to this?
Yeah, yes.
I'm looking at my page. I've posted a few things. And
so this may be overly basic, but just how to send the first tweet is you press the blue tweet button, put in what you want to say, and tweet it out.
Don't you have to put in what you're going to say before you press tweet?
Yes, yeah. So I press this, I put in what I'm going to say. So if I was typing it, I'd be typing it out. And then when you have what you want to say, you tweet it.
Okay.
Does that make sense?
Yeah, I don't know. I have to figure out how to make this half the screen. I mean, I can minimize it so it disappears, but then I don't have.
So if you don't need to watch me, if you know how to tweet and you can just listen to my instructions, then maybe just minimize the screen. And if not, then just follow along with Twitter on your phone for today. And like, you won't be able to copy paste, but you can just kind of.
I see. So I could copy and then paste, go back and forth between the screens.
Exactly. Just go back and forth between the screens. So I wish.
What are we copying?
What? Sorry. If this is assuming it was going to be your first tweet, what I have written out is, it's not safe to protest Cuomo Medicaid cuts in person. So I made a Twitter account and joined Brooklyn Grows to tell Cuomo. And then the people we have added here: Andrea Stewart-Cousins, James Skoufis, Gallgren, Brooks, Felder, Kaminsky, Kaplan, Martinez, and Savino. Those are the 9 holdouts for the New York Health Act. So those are the 9 Democratic state senators who are not yet in support of the New York Health Act. And if any one of them were to change their mind, we have the votes to pass it. So what I wanted to show you, let me lag back out. Sorry. So what I'm going to do the next time I teach this course is
you'd have to be tweeting this to them personally, right?
exactly. So that's what I'm teaching you to do today. So
Find other people.
So for example, when earlier today, when Charlie wrote, I'm with at Brooklyn Grows for this Zoom mini action. So what happened when Charlie wrote that tweet is their tweet showed I got a notification saying Charlie tweeted at me. And so I see here this tweet. So what happens is when Charlie tweeted out to at Andrea Stewart Cousins, at Jane Skoufis, at Godwin for Senate, these politicians all just got a notification saying we're against Cuomo's Medicaid cuts and we want to pass New York Health. So I'm going to like that and retweet it. And when I liked it, everyone who was added in this tweet got a notification saying that I liked it. And everybody who was added in this tweet got a notification that I retweeted it. And this is essentially the whole nugget of wisdom I have to share with the group today. And like, this is the premise of the activism I'm trying for us to learn and do together, is that in the past, like, I was trying to get a meeting with a particular state senator, and I was calling his office and leaving messages for like 2, 3, 4 months. And then one day I tweeted at him and it got retweeted like 15, 20 times. And the next day, somebody from his office called me and said, hi, we heard you wanted we heard you were looking for a meeting. We're free Tuesday. When can you meet? So most state senators, let's see if I have on the slide. No, but most state senators have between like 4 and 7 people on their staff. And if they don't operate their Twitter account themselves, the person who operates it for them, they talk to every day. And so whoever's operating their Twitter account at the end of the day is going to say, hey, we just got like, we got 100 total notifications today and 90 of them were about the New York Health Act. That tells the senator, oh, shoot, I should be thinking about the New York Health Act. In the same way where the issue I was trying to get in touch with the senator about to talk about the hospital in his district, he was ignoring my emails, but when he saw, oh, there are at least 15 people on social media who also care about this issue enough to retweet it, and I know that they all did this because when they retweeted it at my handle, I got a notification saying they did it. Ooh, this is something to keep on my radar. So this is the whole idea of doing Twitter Tuesdays is right now, like as we're doing this, as you see, like my notifications keep growing because people are adding me. The notifications of all of these senators are growing as well. And on an average day, they get 0 tweets about the New York Health Act. Essentially, Anu is on this call, but it's like if me, Anu, or Scott Desnero, another Twitter activist, if like there are only a handful of people who are who are communicating directly to the people whose votes we need on any kind of regular basis. And it's super easy for them to think like, oh, well, that's Katie, Anu, and Scott who want the New York Health Act passed, not the state of New York. If regularly, every time somebody tweets at them to pass the New York Health Act, that gets a bunch of tweets, then it keeps putting it on their radar that, ooh, this is something that constituents want. This is something that there's demand for. This is something that we should be focusing on. And so so that is the, like, essentially what I wanted first time tweeters to see, is that when you tweet at somebody, that they get that notification. So just earlier today, there's a doula, Jessie Pernaris, is trying to bring attention to an issue that has to do with infant maternal health, and so she wanted me to see it so that I could help boost the issue. And so she tags me, and then it shows up in my notification. And in the same way, like as a coordinated action, we can get, hey Daisy, we can hopefully bring things up. So this is one way to use Twitter for action. Okay. Let's.
But what does it say here? It's not safe to protest in person. So I made a Twitter account and joined. Okay, so I could copy that.
Mm-hmm.
No, it won't. It won't copy from your screen. For that, it has to be in the chat box to copy it.
Yeah. So copy it from the chat box, or you write your. I mean, I wrote these tweets out to copy paste just to keep things going, because like whenever I think, oh, let me write a quick tweet, I end up spending like 20 minutes playing with the wording. So these are just sample tweets. Feel free to change them, to personalize them in any way. I just figured I'd have them be copy paste for the ease of this action.
Okay, I think I got it now. All right, so I've copied, and now I go to my.
Yeah.
Quick question, Katie.
Yes.
About, is it more effective to tweet your own tweet than reposting or like sharing somebody else's tweet? Do you sort of suggest doing both?
Whatever. So the writing out your own tweet is always going to be more effective, and
Right.
retweeting other people with a comment is like a little gift you give to the person who tweeted initially, because it allows them to retweet it and put it up again in their timeline.
Got you. Okay, thank you.
But I guess what I want to make clear though is, if you don't have the emotional energy, or if you're timid, or if you're not into it, if you're, if you don't have the time to write something out, just following people and retweeting them a bunch. It's if you're looking for the ats. So this is normal Twitter versus Twitter for activism. So normally when you're tweeting thinking about who follows me and what are they going to see. But how I'm trying to teach you to think is whose notifications is this going to pop up in?
Right.
So I guess it's way easier to just keep popping things up in notifications, and so that is a great place to start. And then kind of as you see how other people tweet, starting to add your voice in when you feel comfortable and have the time and emotional energy is my thought.
I did it.
Awesome. Let's
you should be able to see it because I said at.
Exactly.
Right?
So you saw that when you did that, I had a new notification here. And so I come to my notifications and I see Leslie.
There it is.
Perfect. I'm your first follower. Happy to be your first follower. I'm going to like it and retweet it. So in the last 10 minutes, these 9 holdouts have heard more about the New York Health Act on Twitter than they have in the last months, maybe ever. We may have just done the most effective Twitter action as far as getting the people whose votes we need to have a bunch of notifications about this. So let's
everybody today is tweeting that, and that's going to add to the action.
Exactly. So
everybody on this call. Okay.
Exactly. And so if you guys if you can in the chat box, if you want to just copy paste your handle and send it through into the chat box, or for all you all who are looking in my notifications, if you got like, you know, just Charlie look up Daisy, Daisy look up Charlie, and if you all cross follow each other, then you'll be able to retweet them all. So like in the best case scenario, like all seven of us will all retweet Daisy, all seven of us will retweet Leslie, all seven of us will retweet Corey, and in that way the holdouts will get, you know, if all seven of us retweet those things, they've gotten 21 total notifications about the New York Health Act.
Right.
Which may mean nothing, or it may be the thing that says, oh right, like I've been and it pushes me along this way. It's been effective in other ways, so hopefully it will be effective here too. Okay. Oh yeah, so I just talked about this. So if
Katie, I have a question.
yes.
So if we retweet versus if we retweet with comment, it's still the same number of notifications, right? It's just like the comment gives the original tweeter like something to kind of like add back into their feed.
Exactly. So if I retweet Pass New York Health at the Holdouts and you retweet me with if you retweet me, everyone added gets a notification. If you retweet me with a comment, they get a notification with or without a comment. But with a comment, I have something now to retweet and to circulate it, so that like the retweet with comment may get more notifications still going. Does that make sense? So it's one of those things, like if you have something, if you have a easy comment to put it, and if after 30 or 45 seconds you don't like, you're still struggling with a comment to add, just I'm helping out by doing the simple retweet. So I want to give so a really simple way to support New York health activists on Twitter is just to follow us, and when you see that we are replying to somebody or we've added somebody, retweet us. And if that's all you do for the next couple of weeks, like you'll learn a ton about New York health policy, because the people who tweet about the New York Health Act are the most active New York health justice policy people on Twitter. I think there's a good overlap between the two. And then you'll see how we are using the platform to try and get in touch with people, and it will give you ideas of how you can use it in your own context and your own life story. So,
Katie,
and
are you also going to talk about not notifications? What is this? Like the little alarm bell? That didn't help. I'm not here. Okay, let me share my screen with you, perhaps. Share screen. I can't do that because I'm a participant. But like, if you always want to hear what someone's saying.
Oh, Anu knows how. I think Anu mentioned this earlier, and I was like, oh, I didn't know Twitter had that function. Anu, any chance you can unmute yourself? And do you know what Kendall's talking about? Oh, look at all those notifications popping up there. Damn. Awesome. Okay. Kendall, I don't know. I've heard of what you're saying. It sounds super important. Why don't you show me after, and we'll incorporate it into next week's Twitter Tuesday.
Cool.
Yeah, I'll learn something new and make a slide. So the link I just sent everybody is to this tweet, and it is essentially the tweeted version of this very simple strategy. And an easy way to follow us all is just to like click through on this tweet, because I have us all added. And then I wrote a blog post that explains the basics of this, like how to get things into people's notifications and support activists in that way. All right. So like I wanted to, if you're feeling overwhelmed and that was a lot of information for you, then feel free to kind of check out and come back to another Twitter Tuesday and we'll learn some more advanced skills. I thought some fun like homework for Twitter beginners is follow all your elected representatives. So like your city council person, who's the head of your community board, like everyone top to bottom. What are some nonprofit organizations you generally like and support? Kendall, thank you so much for joining us. I'll see you soon. Who are some prominent people in your field? If you're a doula, who are like the doulas that you follow or want to keep tabs on? If you're an OB, following ACOG, like the professional organizations. Who are who's just like, do you like for fun? Who's like comedians and actors and actresses you like? That will, give yourself some levity on your Twitter feed. Also think do I like any famous people who live in New York? Because in the same way we can try and get the holdout, get into the notifications of the holdouts. What if Seth Meyers did a section on the New York Health Act? What if we could get, someone who's famous and based in New York to use their platform to bring more attention to it? One way we get in touch with those people is it can be through Twitter. I've tweeted at Busta Rhymes before because he's from East Flatbush to be like, hey, I worked at a hospital in East Flatbush. Can you help us? But so I would say, if you're feeling overwhelmed, feel free to, this is enough for today and see us next week. But please keep coming back to Twitter Tuesdays because I'm learning how to do this. And I even just all of the retweeting we've done so far, I think is cool and hopefully puts us on the radar for this week. Invite your family and friends, use social media to promote this. Yeah. All right. So where do we go from here? So I was going to have folks look up their representatives to see if they are supporting or not supporting the New York Health Act, but I think all y'all know that already. So what I was talking about before retweeting, that's supporting the New York Health activists. So how do you become a New York Health activist on Twitter? These are just ideas, just using your feed to educate and inform, keep the New York Health Act in conversation. Most New Yorkers do not know we are one vote away from having universal single-payer health care.
Right.
So, a lot of people, so just tweeting, once a day or putting in your Insta feed, hey, did you know we're one vote short? This is actually a viable reality for us. These are the things that would need to happen to make it go through. And I have here just to go to the New York Health Campaign website and sign up for updates from them. And if you go to their website here, Take Action Resources, on their website, they have a bunch of stickers and icons and things that you can use to make your tweets more visually appealing and stand out. So take some time to familiarize yourself with what's going on the with the campaign's official website. And then I was for our to do activity, I was just going to have us look up whether or not your representative supports the New York Health Act, and if they do, thanking them and asking them to ask their colleagues to pass the New York Health Act now. But so feel free to do that if you want to, but I think Montgomery, Daisy is yours and she's not on social media. Myri's already been super out ahead of it, so that may be a little overkill for who is in today's Twitter Tuesday. The second is flipping the vote. I don't think we have any constituents of any of the holdouts here, but we can retweet ugh, why is this not? Sorry. But a constituent from a holdout district was here last week and retweeted at Felder. So if you click on that link to the tweet to Simcha Felder, you can retweet both what Mandy said here and the retweet with comment that I say. Both have Felder tagged, so both will send Felder a notification. And essentially, like at every Twitter Tuesday, as I have holdouts coming through, I'm going to make slides so like every week we can send a constituent written tweet straight to the holdouts. So then another strategy I'm working on for the holdouts is the main hashtag for the New York Health Act is at the main hashtags are hashtag new NY Health Act and hashtag Pass NY Health. So I've started my own hashtag, which is RT Pass NY Health, which stands both for reasons to pass New York Health and retweet to pass New York Health. And so what I've started doing is essentially marking when I see a tweet that is like a one tweet argument for why we need single payer, I retweet it with this retweet to pass New York Health hashtag so I can find it here. And then so what I'm hoping we would do now is essentially everybody, so if everybody looks at the retweet to pass New York Health and essentially picks one of these tweets and writes out a tweet to the holdouts saying like, 52% of Americans have lost their job and 35% under 35 say they don't have health insurance. So I want one of you to like click on this, retweet with comment, put the 9 holdouts and say like, hey, it's totally ridiculous that healthcare is tied to employment. We're one vote away, hashtag Pass New York Health.
I'm sorry to ask these stupid questions, but how do I find that post? Or is there like a way I can search for?
Yeah. So if put up here in the search bar.
Yeah.
The search function for Twitter is pretty great. So if you just put Pass New York Health Act,
okay, with no
hashtag, it's going to bring up most of the tweets you want to see. If you put in the hashtag specifically, it brings you only exactly what you put in the search bar. So by searching retweet to Pass New York Health, all you're going to see are like tweets I've hand selected as being like one-off arguments for single payer healthcare.
Okay.
So what I haven't done successfully in a Zoom setting before, but I was hoping we could try now, is each of us taking one of these tweets. So like, essentially someone volunteer to do Abu Karim's tweet, somebody volunteer to do Karine Jean-Pierre's tweet, but essentially you're going to click on this citizens who have lost coverage in the past 2 weeks due to economic collapse. United States, 3,500,000, everywhere else 0. Totally ridiculous, right? So like, I want someone to retweet this with a comment like, nobody should be losing their health insurance just because they lost their job, Pass New York Health, and retweet it at all of the holdouts. So I'm hoping like everyone on the feed takes one and does it, and then we send them to each other and retweet them out.
Okay.
Do you want to take this Karine Jean-Pierre one, Daisy?
Yes.
You think you can come up with a punchy one sentence?
I think I can do it.
Awesome.
But can I retweet it from you? Is that what I'm doing?
No, so your retweet, like as Daisy, you're like as Daisy, you're coming up with your own reason why this is ridiculous. And
I'm sharing Kareen's tweet. Okay.
Exactly.
So understand.
You're retweeting Kareen and because this is like such a great argument, but the New York Health Fact, but the holdouts may never see this tweet because they probably aren't following Karine Jean-Pierre. So by retweeting it by putting in the comment their handles, we're making sure the holdouts see this good argument and just in a different way, boosting the New York Health Act message. Does that make sense?
Got it.
So Charlie, would you be game to do any of these look good to you? Do you want to craft a tweet and then we'll send them through to all retweet one another?
Sure. Yeah. Actually, I just retweeted something from Andrew Cuomo where he said our frontline workers deserve hazard pay. They deserve a 50% bonus. They are carrying us on their backs through this crisis. People of color disproportionately make up the brave frontline. And so I retweeted it with a comment and just said, funny how you've underfunded predominantly Black serving hospitals in Brooklyn for years, forcing these same frontline workers to work understaffed shifts at the detriment of their patients. But you'll address racial disparities when they make you look like you care about POC. I kind of wanted to get your feedback to be was there anything else? I ran out of characters, but I wanted to put hashtag equity for downstate on there. But is there is there a way that I could have tweeted this differently to create more notifications or be more effective?
So this is the perfect tweet for when you have more followers. And because this is a perfect, so it's I don't want to, so it's a perfect tweet for when you have more followers, but because you didn't @ anybody, nobody gets notified when this gets retweeted.
Oh, only Cuomo, who's not gonna put it on his. Yeah. Okay.
So Cuomo's gonna see this.
That was my question, because I have trouble imagining what happens on the other end. Once I hit tweet,
So Cuomo's gonna see this, and the person who operates Cuomo's account is gonna, probably won't. Unlike the state assembly people and senators, Cuomo has quite a lot of Twitter activity. So, Twitter is not the best way necessarily to get something on Governor Cuomo's radar because there's so much going on in his Twitter feed. So that
okay. I have a follow-up question to this then. I originally found his tweet on Tremaine Wright's feed because she had retweeted it. And would it have just made more sense to comment this on her tweet so that all of her followers would see it?
So comment there. And then also with Wright, you could say thank you for bringing attention to this, Assembly Member Wright. Also, we've been trying to make a meeting with you. Some of your constituents who are frontline workers have been trying to make a meeting with you for a year and a half. So that's the other way to use it. And getting into replying to state senators was the very next suggestion I was going to make, which is essentially follow the holdouts. My guess is that all of the holdouts have been tweeting things thank you to our nurses and doctors, the healthcare heroes at the front line. And so occasionally I'll reply to them the people on the front line are asking you to don't thank us, do what we're asking you to do, which is pass the New York Health Act. So this type of tweet is good, Charlie, because this is why people will start to follow you. If all you ever do is retweet other people, then people won't follow you because you're not thinking of them. You're just thinking of the notifications. This is the type of tweet that gets oh, this person actually has something to say about hospitals in Brooklyn. I should follow them to learn more about what's happening there. The notifications is something to keep in mind as a part of the overall strategy. All right, let's go. We have 10 more minutes. Okay, so what I would, so if you wrote a tweet under the retweet to Pass New York Health, if you wrote one that to the holdouts, if you like take the URL, like open up what you tweeted so it's the main tweet, and then grab the URL. This is how I'm sharing all of the tweets. So that I just did as an example, but grab the URL and send it to the chat box so we can
I want to
retweet.
make the point that I just spent so long with my Twitter on top instead of like latest, so I kept searching over and over again and I couldn't find anything. So just maybe someone else is as clueless as me. Don't do that.
Yeah. Oh, thank you. Yeah. Thank you so much for bringing that up. Top is like, who knows what the Twitter algorithm uses to determine what's the top tweet or not. But latest just shows them in exact reverse chronological order. So yeah. So does anyone have a tweet that they want us to retweet from this exercise?
I'm close. I just found it.
Cool.
Sorry. I'm a little behind.
No worries. Corey, how are you doing? I don't mean to put people on the spot, so I'm just trying to check in.
Hi, thank you, Katie. Sorry, I had to answer calls, so I got kicked off. But I'm making a tweet for Senator Felder. He's my. I'm in Kensington, so I'm just about done, and then I'll tweet it, and then you guys retweet it. I'm replying to a tweet that he made about Cuomo's no one will be birthing alone, which was great, but I'm saying like that was great, but what would be better is if you passed NY state health. Also, a question, is it like super important that all of the hashtags have the exact capitalization and like,
yeah,
how does that work?
So from what I can tell, the capitalization does not matter, just the letters. The reason to capitalize things in a hashtag is just to make it like it's easier for me to read it when the letters are capitalized than if they're all lowercase. But that's just like a style thing, not a coding thing.
Okay, and then the hashtag for the Pass NY, it's Pass NY Health.
Mm-hmm.
Okay, great.
So hashtag Pass New York Health. So this is another, like, if you're just bored, you can search the Pass New York Health hashtag in this, like, essentially in the same way that I said to follow the activists. You can just look at this hashtag and see us. Here's Kendall tweeting about it that I missed before. So pretty much everyone tweeting about this right now is at our action. But it allows you to participate in that way. All right, let me see.
Katie, I put other hashtags like healthcare is a human right. Does that work in a similar way to like Instagram? Or no?
It works in the exact same way in that it like links everything. And like lets people like that if you click on that hashtag, it shows you everything on Twitter under that hashtag.
I was trying to retweet your tweet with the orange graphic. Our healthcare workers are fighting for the public good, and I wound up retweeting the thing below it. No one should have to get hitched for healthcare. How did that happen? Aren't they separate? I didn't mean to do that.
I do. My guess is it's just you hit the wrong button.
Katie, I had the same question actually. I think what happened is that if someone if you're on someone's Twitter feed and they have retweeted someone's tweet, then that when you retweet, it retweets the original one and not the one that that person has written. Like for example, the tweet that I commented on that Tremaine Wright had retweeted from Andrew Cuomo, it directed back to Andrew Cuomo, not to Tremaine Wright. So I'm not sure if there's a way to.
Okay, if Tremaine Wright retweets something, and you it may be worth just adding her name in the reply to make sure she sees that reply and doesn't get lost in the Cuomo replies. Does that make sense?
Yes, but I think. But I'm understanding Leslie's question is how to directly retweet the person who has retweeted and not the original tweet. Is that what you were wondering? I don't want to speak for you. I think I just had the same issue.
I just when they prompted me to say view tweet, what actually came up was something that I had no intention to tweet, and I was definitely hitting the icon right below Katie's tweet.
So I mean,
there's a box underneath it that has your. Yeah.
So I'm not sure why that happened. I keep playing with it. The more you play with Twitter, the more idiosyncrasies will make themselves known. If you retweet something that you didn't mean to, or you retweet it and then you change your mind, all you have to do is press the green recycle arrows again and undo retweet. So I'm retweeting Corey, and then I changed my mind. I don't want to undo retweet.
All right, you should see my tweet. I guess that's what I'm hoping. Or my retweet of your tweet.
So I mean, I see that you've retweeted me here. Perfect.
Yes, that's it. Okay.
Yep. So that worked.
All right,
so
great.
you retweeted me, so it came up in your timeline, and everyone here got a new notification. Perfect.
I have a quick question about tagging people. I have all these tags from our group chat, and I'm wondering, should I be attaching? Is that all of us? I'm not quite certain who that is. I guess it's us, right? Brooklyn Grows, Anu, somebody named Julie. You know what I'm talking about when you sent us all of the
okay.
tags?
Yeah, those are the those are people who I'm recommending that you guys follow because they tweet about the New York Health Act a lot.
Oh, word. So I shouldn't tag them in my tweet.
So first off, all of us are lovely people and very forgiving, and all of them know I'm teaching Twitter classes. So if you're tagging them inappropriately, they'll just roll their eyes and be like, "Oh, Katie must not be doing."
I'm sorry.
Katie must need to be ironing out the tweets in her Twitter class. So no worries. And also, a lot of these people
Thank you. I'm gonna go.
Yeah, have a good one, Leslie. Many of these people, Anu and I many of us are happy to be tagged in things so we see them and are able to retweet you. Okay. So anytime you tweet at the holdouts, tweet at them and then retweet it again at me, or DM me that tweet just to make sure I see it, and I'll be sure.
Can I tag you next to them, or then it will be too confusing?
If you can feel free to tag me inside the same tweet. Yeah.
Mm-hmm. That's kind of my concept right now.
For sure. Okay. That definitely works. And it's if you run out of characters, then leave me off and then
got you.
Add me in a different one at a different time. Let's see, are there any so I think that's yeah, so support New York Health Act. So just a couple more things while I have all your attention. Here are people who are running for office who support the Health Act against people who do not support the New York Health Act. So there are other people who are running for office who support the New York Health Act running against people who also support them. They're not on this thread. And there are people who are running against people who don't support it, who have not spoken out clearly on it, also not on this thread. These are the 4 people who, if they won, would flip a vote for the New York Health Act. So just follow them, like them, boost them in other ways. 2 of them are like pretty small campaigns for Black women in upstate New York, and like just all the ways we can support them. It will be great. So follow that. So if you come back next week, I'll teach you how to make a Twitter list so you can keep track of the holdouts and like reply on their comments without following him. And then just, I like Senator Gustavo Rivera, and I want him to like the work that I do. So feel free to click through on this last link and retweet him to Governor Cuomo about these Medicaid cuts.
I am not nailing this. I'm sorry. Just give me a couple days.
No, so like Daisy,
Me
something
neither.
I'm trying to figure out is like,
I'm still
Oh, God, I suck. How do I delete a tweet, guys?
oh, that's easy. Let's see. Profile. So just, oh, sorry. So I can't, I guess I have to go.
You retweeted.
I think I have to find something I wrote myself. So when you write a tweet yourself, you click on this down arrow here.
Mm-hmm.
And you can.
What if I didn't? What if I just reposted it?
So if you reposted it and you don't want to anymore, then just click the undo retweet. So where the recycle button is green, you're going to click it and undo retweet.
Okay, word. Thank you.
Yeah.
Woo! All right.
So Anu, can you hear me? I just wanted to, because I know that you're already like super Johnny on the spot. I just wanted to put on your radar the RT RT Pass New York Health. So whenever you see a good tweet that we can use for the Twitter Tuesdays, and just stick that like a 1 tweet case for single payer, feel free to start using that hashtag. I was telling Charlie this idea yesterday, but like a lot of people are complaining about waiting on hold for unemployment benefits. So I was thinking it may be a fun Twitter strategy if someone's bored to like look up New York State unemployment benefits, find everyone who's complaining and tweet at them like, used to get your healthcare through your employer? So join us to advocate for the New York Health Act because we're 1 vote away.
I just in the chat, I just linked to a thread of tweets that I found
Oh, great.
of people complaining.
Exactly. So hopefully, like, I'd love just like 1 tweet we can copy paste in a bunch of people's replies. Like, everyone who's complaining about unemployment on Twitter knows how to complain about things on Twitter. So let's get them complaining about our thing with us to the right people. And hopefully we get it passed.
Katie, could you, I'm trying to like draft something in the chat right now to do that. But can you say one more time what you had said before? Like, did you just lose healthcare through your unemployment or something? Or what did you say?
Yeah, so my thought, so that it's like I wouldn't do this under Brooklyn Grows because it may be a little annoying for some people, or like some people may find it annoying, be like, well, I don't want to help be an activist. I'm annoyed about unemployment benefits. But essentially some like 1-click, like, this is why the tweets always take longer than you think it is, but like, this person, people are so like for this person who's complaining the website keeps crashing, like, unemployment website isn't working, but Twitter does. might get, did you know we're one vote short of passing healthcare that you now need because you're unemployed? Here are the people. I don't know, someone's gonna have to take 30 to 60 minutes to like carefully craft that tweet and make sure it has like the right like a link to a resource that is like easily loops them in. But that's like a strategy for the week, not for necessarily right
What
now.
would be something that like loops someone in? Could that just be like a hashtag? Is that like a tool that you could use to just be like, if you connect to like a hashtag that they would then look up, that would be like, oh.
So I'm thinking like a link to what, like maybe the FAQ on the Campaign for New York Health's website, maybe some of the infographics, like the infographic about the holdouts, with the numbers of like where to call to tell, like the central switchboard for the holdouts. Like it could be a tweet with a link to a tweet with the holdouts added that says like what we copy paste the text says, like get involved with the fight for New York Health, and then it has a link, so we have like essentially two tweets at the same time, and the link is something they could click through and retweet. Well, we'll put our brains together on it. But are there any other? That's all I had. Are there other questions while we're here? Oh, dope. Oh, Mandy didn't even join us today, but because she's been here before, she knows what's going on and retweeted us a bunch. Awesome.
And one more time, the retweet is RT New York Health. Yes.
Yeah. So I'd say for you, Daisy, don't worry about that hashtag as much. That's more so like on Twitter Tuesdays, I can find the one tweet wonders for single payer.
Okay.
As a newbie, just focus on the established hashtag, which is Pass New York Health.
Word. Okay.
And then like, because you guys haven't hung up yet, like this is, as we learn to do that, like even in this, like the three of us, Daisy, Charlie, like the three of us on Twitter could be really powerful getting right one way or another. So like,
is she tagged on here in with our that you sent to us?
No, because she does support the New York Health Act. So for today's action, getting in touch with her wasn't so prescient. But like, so just so just something that like Emma, Charlie, Nicole, and some of the other Equity for Downstate organizers have been talking about is like how we partner with Cancel Rent. So we're getting involved with the local tenants unions to better understand Yuling Nguyen's bill to cancel rent. But like I think there's a bill that says rent would be canceled for everyone for 3 months. That right is not signed onto. So like using the skills we learned today can be used for any bill, things like cancel rent,
Right.
Things
Understood.
like there's like a eating disorder awareness bill that right isn't on, that if the three of us tweeted at her to be like, hey, this bill's free, just just be a co-sponsor, help the activists who wrote this bill out by co-sponsoring it. Like I'm excited that the two of you guys are here because it opens up a bunch of right strategies to have other constituents who know how to talk to her on Twitter. So Daisy, this is awesome.
Okay.
I saw this is perfect. You're perfect. Like you got the one sentence out there that connects the information in the tweet you retweeted to the policy that you want the people to promote, and you have it directed, and it's going to show up in the notifications of everybody who needs to change their mind to promote that policy. Perfect tweet. Awesome. So we're gonna.
Is there a way I could possibly save, like this Zoom chat is so helpful because I have all these like copy and pasted. Will it be saved somewhere or? Maybe I should just make up myself a document with all of
I would say right now, just go ahead and like copy paste everything in the chat to your own thing. On my YouTube channel, there's a recorded version of something similar to this that may be interesting to like just rewatch, you know, while you're folding socks.
Right.
And Scott Desnoyer, who's another, who's like probably the most active New York health activist, came on that with me and shared some insights.
Who's that?
Which is cool. Scott Desnoyer, he's in that list that I sent through.
Yeah.
His son was denied his SSRI because he forgot a $20 copayment, and it's like a known side effect for suicidal ideation, and his son killed himself because of a missed $20 copay. So like he tweeted about that when he had like 38 Twitter followers and tweeted like, I'm just so mad right now that our system killed my son. And when he came back from his son's funeral, it had been retweeted like 2,000 times, and he was like, oh, I have a platform.
Yeah, totally.
So that's like kind of what got me started thinking like, oh, I should teach people how to use Twitter, because like folks like Scott should have folks like us who can retweet him and like boost the message that he is getting out there. So I just Charlie, I sent the link to Daisy's tweet if you wanted to retweet it. Oh, dope. Carmen's joining us. All right. Any other questions for today?
I'm all set, I think.
Cool. Thank you guys so much for coming. I'm excited to see what we get up to with our social media.
Hey, Charlie.
Well, I guess I've
been figuring this out with y'all. Thank you, Katie.
Yeah, I'm gonna go eat lunch, and hopefully I'll see you guys next week.
Totally.
Some more shenanigans.
Take care, y'all. Stay
Have a
healthy.
good one. Bye.